Hello friends, in this video we are going to see about what are all the surgeries that can be done under spinal anesthesia. So what is spinal anesthesia? Some amount of drug is deposited through the back near the spinal cord through which your lower body gets numb and surgery is done. This is in general about spinal anesthesia. If you want to know more details about it, leave it in comments. I will try to make a separate video. So for doing a surgery, why do we need anesthesia in the first place? So whenever a surgery is done, it produces pain. So we need to get relieved of the pain. That's why we give anesthesia. So where does the pain come from? So the entire body is supplied by nerves. All these nerves are exiting from the spinal cord like shown in this diagram. So each and every nerves existing from that region of the spinal cord supply the region over that nerves. So based on the region it is divided. When it is neck region, it is called as cervical. So cervical, there are 1 to 8 nerves. So then if it is in the chest region, it is called as thorax. So thoracic nerves, they are 1 to 12. So if it is in the abdomen region, stomach region, it is called as lumbar nerves. It is called as L1. There are L1 to L5. So when it is in the hip region, they are called as sacral nerves. It is named from S1 to S5. 5 nerves are there. So what are the regions these each and every nerve supply? That diagram is called as dermatome. That is shown in this diagram here. Okay, so when the nerves can be blocked with the help of the spinal anesthesia, then all the nerves can be just blocked with spinal anesthesia and all the surgeries can be done under spinal anesthesia itself. Then why there is a need for general anesthesia? So what happens is the nerves that supply the heart arise from the level of the T5, as I have marked in the yellow line in this diagram, you can see. So from that level, the nerves to the heart arises. So when the drug blocks that nerve, it causes decrease in heart rate. It can even lead to cardiac arrest or heart attack. So we don't want all those side effects. That's why whenever we give spinal anesthesia, we maintain till maximum level of the T6, usually T8, T10, whatever the level that is required for the surgery, we give that level and we can do the surgeries for that region. So if it is upper body or even if it is in the upper part of the stomach, we cannot do surgeries under spinal anesthesia. In simple terms to remember, all the surgeries below the umbilicus can be done with the help of spinal anesthesia. So now you can say what are the surgeries that can be done by yourself. So what are the organs that is present below the level of the navel in female? Usually there is uterus. The most common surgery which is done is for pregnant patients. Cesarean section is done under spinal anesthesia. So other than that, if you want to remove the uterus also through total abdominal hysterectomy or vaginal hysterectomy, then you can do it under spinal anesthesia. All the procedures related to the tubes, uterus, cervix, vagina and all those regions can be done under spinal anesthesia. So most of the gynecological surgeries can be done under spinal anesthesia. Then comes the urology. So usually for kidney surgeries, it is not usually done under spinal anesthesia because of the higher level. So then comes the ureter and the urinary bladder. So all the surgeries related to that can be done under spinal anesthesia. For example, if there is stone in the ureter, stone in the urinary bladder, that can be done. If there is a tumor in the bladder, TURBT, that can be done under spinal anesthesia. So in males, there is the prostate and there is penis. So any diseases related to them can be done under spinal anesthesia. For example, TURP, transurethral resection of the prostate for big prostate, can be done under spinal anesthesia. So if the urethral opening is not appropriate, all these hypospadias surgeries, all the surgeries related to the penis can be done under spinal anesthesia. When it is related to the general surgery, the appendix is usually in the lower abdomen region and also hernia, which is also in the lower abdomen region. So if they are being done under open, then they can be done under spinal anesthesia. But usually these days, hernia and appendix surgeries are usually done under general anesthesia because they are usually done laparoscopically. For laparoscopy, we cannot do it under spinal anesthesia. Why laparoscopic surgeries cannot be done under spinal anesthesia? If you want to know more, just leave it in comments. I will try to make it as a separate video for that. Okay, so sure. Now we have known that all the lower abdominal surgeries and the organs related to that can be done under spinal anesthesia. So when it is then come to the lower limb, in the lower limb what all the things are there? Muscles are there, nerves are there, blood vessels are there, and bones are there. So whenever these things comes, bones, it is always orthopedic surgery. So what are the joints are there? Hip joint, knee joint. So hip joint replacement, knee joint replacement can be done under spinal anesthesia. So then there are bones, femur, tibia, fibula, more bones are there. So if the bones, there is a fracture, then you can get it done under spinal anesthesia. So if there is a tumor in those bones, then you can get it done under spinal anesthesia. So if you want to amputate the foot, above knee amputation, below knee amputation, or transmetal tarsal joint excision, or you want to cut out a finger, all the surgeries can be done under spinal anesthesia, mostly in general. Okay, so apart from that, there are vessels. If you have varicose veins, then vascular surgeries can be done under spinal anesthesia. Some plastic surgeries and reconstructive surgeries for any deformities can be done. For example, split skin grafting, all those things can be done under spinal anesthesia. So apart from that, there is a beautiful technique even inside a spinal anesthesia. It is called a saddle block. So in spinal anesthesia, the drug is deposited in the CSF, which is a fluid around the spinal cord. So if you are depositing in that place, how something is put into a fluid, then how you are exactly titrating the level to T8 or T10? So it might go upward also. Now even it might go to T5 and block the cardiac fibers. How it is possible? If you ask that question, then comes the concept of the density. If you put iron inside a water, it stays down. If you put oil inside a water, it stays up. In the similar way, depending on the density, the fluid which should be below, which should be above, it depends on the density. So this spinal anesthesia, hyperbaric bupivacaine is usually given. So this is called as 0.5% bupivacaine heavy. This drug, if you inject, it usually settles down, so it doesn't descend up. After 10 to 20 minutes of time, the entire drug gets settled there, so that the chances of this drug spreading up is not there. Okay, so but after putting spinal anesthesia, if you're not letting the patient lie down, if you're making the patient sit, then all the drug will get deposited only in this area, which is marked as yellow color in this diagram. So only that area will become numb. The advantage is the amount of drug which can be used can be reduced, and also unwanted lower limb numbness, if it is there, then we cannot move the limbs for 2 hours, 4 hours, 6 hours, whatever the time it may be. So we don't want all the side effects. All the side effects of the drug can also be reduced. So that's why there is saddle block or saddle anesthesia. So all the surgeries related to the anal region, indent around the anal region, can be done with saddle anesthesia. So for example, what all the surgeries? Fistula surgeries, sometimes fissure and hemorrhoids, and pylonidal sinus, ischiorectal abscess. All these surgeries can be done under saddle block. I hope this video was useful for you. If at all you have any doubts, you can leave it in comments. I will answer them definitely. And if at all you want to know any medical related if at all you want to know about any medical related topics or any anesthesia related topics, you can leave them in comments, so that I can make them in the upcoming videos. I hope this video was useful for you. I will see you in the next video. Until then, it's Dr. Aravind signing off. Thank you. Be blessed.